there is there's this new push, I don't know if you're familiar with this, to go away from Biest creams and just use estradiol, because
Mhm.
there doesn't seem to be a lot of evidence for using a Biest like is so popularized here in Canada. I know some places use a Triest even. Can you comment
Mhm.
on that, and whatever you know, or what you've seen so far,
Yeah.
whether or not Biest is actually an appropriate prescription to make?
Absolutely. So, um, first, to differentiate Biest and Triest, I'm actually quite glad that we're not seeing as much Triest as Biest in Canada. The reason being that Triest utilizes estrone, the third bioidentical estrogen, which has been more so linked to certain adverse outcomes like breast cancer. So estradiol and estriol are the two components of bioidentical estrogen in Biest. And estradiol is probably better studied. The reason being that commercially available products that contain estradiol have been well funded and well researched.
Mm.
So I'm talking about patches like Estradot, or topical gels like Estragel or Divigel. So because those have been funded for research, we know for sure that they work. So they're considered quote unquote more evidence-based. Um, Being that Biest contains estradiol, by extension, that part of Biest is evidence-based. Topical estriol is a little bit less evidence-based, but I wouldn't say that it's not evidence-based. We do have some small studies showing that Biest does work and is effective for hormone replacement therapy for symptom control. In theory, estriol is what I consider to be estradiol sparing, because we know that estradiol and estrone are the two estrogen hormones that increase the risk of breast cancer, but we haven't seen that same level of risk associated with estriol, which is considered like a weaker bioidentical estrogen. And so if we can get away with a higher percentage of the estrogen cream be estriol, it'll offer the same benefits or similar benefits in in symptom control, but maybe we can get away with a lower estradiol dose. So although that isn't as evidence-based, we don't have a large RCT comparing, breast cancer outcomes between Biest and estradiol, and I don't think we ever will. That type of study is really hard to do. It takes a really long time, and nobody's funding the compounded. Um, in theory, I think it makes sense to me. And I don't see any reason why Biest would be less effective than commercially available estradiol. I will say that because Biest has to be compounded by a pharmacy batch to batch, there has to be consistency, and that particular pharmacy has to be reputable in that they are working with a reputable compounding supplier, that they have the credentials to do compounding, that they're doing batch testing, all of that really important stuff. So I think that's another hang up that prescribers or conventional medicine might have, is just consistency and lack of testing compared to commercially available products.
I feel like a lot of our conventional counterparts are very much, I don't know if they're necessarily averse to, but it seems like they're averse to Biest creams because they're just so used to prescribing estradiol, just pure estradiol at higher
Mhm.
dosages. And what you've just described is the reason, the rationale for why a lot of naturopathic doctors use Biest creams, for that sparing effect, for the mechanism
Mhm.
that estriol is going to work. So this just helps me to understand that there's not a missing piece, like that there isn't that much evidence for it, but that the theoretical component is probably quite strong in that it would make sense that it would work in the way that we'd hope it to, but we're not necessarily going to get a big study coming down the line that's going to help us feel validated in that way.
Yeah.
But as a pharmacist, you feel comfortable with that.
Yeah, absolutely. I think the other piece that I try to take into consideration is patient preference. Like a lot of the times, if the patient has extended benefits, but the benefits don't cover compounded products, then perhaps a commercially available estradiol only product is an okay choice for them if they don't have other risk factors, because they might be able to have that at a more economical cost. So it goes both ways. I think they should all be open options for the patient.
Is there any way that we can, with like thyroid prescriptions, desiccated to compounded T3 and T4 to Synthroid, there's like a conversion chart
Mhm.
that essentially you can use. Is there anything like that for Biest to estradiol?
Sadly, not to my knowledge. The reason being, a lot of the times because the bases vary, so the bioavailability of a gel or a patch versus a cream compounded might not be 1-to-1. I've not seen like a reliable mathematical conversion the way that we have for thyroid.
Hmm.
So we have to kind of go with dose ranges. So like what's considered low dose, moderate dose, high dose. In that particular product, we would then translate into the counterpart in like a patch versus a
Or
biased. Yeah.
I mean, essentially, when we're making that kind of prescription, when we want to make a change, let's say a patient comes to us and says, "Oh, I've been using the Estradiol patch or something, and I want
Mhm.
to," or you feel encouraged to make a change to a biased cream for them for whatever reason,
Mhm.
you could then just call your pharmacist and be like, "What would the likely equivalent be to make this?"
Right. Yeah, exactly. So just looking at, in our experience, what's considered a high dose of estradiol, and then if they're doing well in the high dose, then doing a relatively high dose of Biest.